Tourette Syndrome, most severe tic disorder. By definition, it must be present for at least a year, and it is defined by multiple motor tics and at least one phonic tic as well. However, importantly, they don't necessarily need to be occurring concurrently, and tics may be either simple or complex, occur many times a day, nearly every day, and the location, number, frequency, type, complexity, and severity all change over time. Don't make the diagnosis unless they've been present for at least a year. The onset, by definition, must be prior to 18 years of age, and typically the onset is 6 or 7 years of age, with a peak in severity around 10 to 12 years of age. A third will resolve spontaneously, a third will improve, and a third will continue without any improvement at all. Comorbidities, once again, very commonly associated with mental health disorders, as well as ADHD and learning disability. How do you treat children with Tourette syndrome? Remember, we talked about not needing to treat the majority of children with tics because they're transient. And if treatment is needed, the vast majority with transient tics need no more than cognitive and/or behavioral therapy. And that holds true for Tourette syndrome as well, in regards to education, counseling, and habit reversal training. However, if they are severe, then there are various medications available. Most of them are antipsychotics. Impulse control and rages can be controlled with the alpha-2 adrenergic agents listed here, and sometimes with focal, motor, or even phonic tics, botulinum toxin injections can be helpful. But it's always also important to treat the comorbidities. So over the last few minutes, we've looked at ADHD, but we've also looked at what might mimic ADHD. And we've looked at tics, and before diagnosing a tic disorder, we looked at what might be causing that tic, like Wilson disease or PANDAS. So all of the mental health disorders that we've looked at so far may be presented on your boards in such a way to tell you that you need to look for an underlying cause before you jump to the specific diagnosis. That's why I've tried to spend some time on here to help you differentiate when further evaluation is needed for an underlying disorder.